But when it comes to the sexual wellness, there's not as many devices, and Gainswave is an acoustic shockwave therapy that we've been using since 2019. Again, the penile vessels are some of the smallest in the body, 1 to 2 millimeters. We want to get not only into those small vessels that are directly going into the penile tissue, but also into the larger vessels in the groin. And so this allows us, even with this device and the way that it's curved, to get right into those groin vessels. If you're buying results, that's what you want. You're investing in health and better blood flow, harder erections, and results. So when it first started to be offered here in the US, again, there was a lot of that doesn't work. And then there's lots of studies to show that it does. And there's also little forums that people will be on too. And we've seen it in practice. It worked. So we've been doing Gainswave since 2019, but now we have upgraded to Gainswave 2.0. So find out why that is better for you and what that means. Welcome back to the channel. It's Dr. Debra Durst, and I'm here today with my co-host.
Hey guys, Farideh Golembiewski, family nurse practitioner here at RevitalyzeMD, and today we have a fun podcast.
Yes.
Anytime we can talk new devices, new technology, new services for patients, it's always exciting.
We love to upgrade. So the science is always evolving, and I shouldn't say always, because some companies, and laser companies in particular, will change the technology a little. It doesn't impact clinical outcomes and just to sell new devices. But when it comes to the sexual wellness, there's not as many devices, and Gainswave is an acoustic shockwave therapy that we've been using since 2019. And now this one is upgraded science. And that's what we're going to talk about today. So you just got back. We both got back from.
Yeah, we just got back from Florida doing protocols and training on this new device. So Gainswave 2.0, or the device is called OmniWave, but that falls under the Gainswave company, and the treatment is still Gainswave. It's just new focused shockwave versus Radial. So better, improved, upgrade.
So we'll start at the beginning with what is Gainswave, even if it wasn't a 2.0 and an upgrade. So Gainswave, number one, it's really a protocol, and there's Gainswave providers. So there's a network of providers that have invested time and money into learning protocols that are standardized to treat specific conditions. And so erectile changes is what we use Gainswave for. So that protocol and what Gainswave is a standard treatment protocol using acoustic shockwave therapy that communicates with the tissue, so that we're going over, the penis with men and into the groin to communicate with the body that something is injured and to get repairs. So we get better blood flow and better health of the blood vessels. And those are the smallest blood vessels in the body. So that's what acoustic shockwave is, which is Gainswave. There are different companies that will call it different things. I personally think that I love when protocols can be standardized so that you know that you're talking the same terms. So I really look to Gainswave providers instead of just a shockwave therapy called different things.
And then you can measure outcomes.
Yes.
They're based on very specific shim scoring, very specific protocols. So as we are prescribing these treatments, we can track improvement.
Yes.
And we can talk with other providers and see across the board the improvements we're having because it is standardized.
Yes. And when you can score something and give it an objective number, that's important for us as providers, but also for the patient so they can see improvement. So if you're looking at an erectile hardness score or a shim score, in 0 or 5 to 25 is a range, 25 being you're 20 and you have no issues.
Living your best life, not in our office.
Yes.
Unless you're just trying to improve.
Yes, correct. And it can always, I guess,
we can always improve.
But basically in 5 is that you have no function, you're post maybe prostate surgery. And so if we can see that number go up based on treatments, and then there's standard protocols and standard treatment protocols. So it's super helpful for us to be able to see improvement that we can communicate with the patient. Because again, you want results. It's not that you're buying Gainswave, you're buying results. That's what you want. You're investing in health and better blood flow, harder erections, and results. So that was a radial acoustic shockwave.
That was the original device.
The original device. And we actually had 3 of them. And
they work well.
They work well. And
still to this day, if someone says, does Gainswave work? Absolutely 100%. It's a fantastic treatment.
It is. And
with proven results.
Yes. And it was used a lot more internationally than even here in the US. So when it first started to be offered here in the US, again, there was a lot of that, does it work? And then there's lots of studies to show that it does. And there's also, little forums that people will be on too. And we've seen it in practice. It works. But now we get to upgrade. So the acoustic shockwave that was radial and radiated out more now will be more focused in. And so deliver that shockwave deeper into the tissues.
And it's a more precise, instead of a broader, superficial, it is a very focused, very further, deeper penetration of shockwave.
Yeah, so you can basically focus in on that blood vessel and get deeper, so deeper into not even just the superficial vessels, but deeper into the tissue and the small. And again, the penile vessels are some of the smallest in the body, 1 to 2 millimeters. And so you want to get deep and you want to get close to those vessels directly to stimulate regeneration. So, yeah.
Stem cell communication, collagen elastin, blood flow, all of it.
We have lots of penis pictures in our office when we're talking.
We draw lots of penis pictures.
That's what I'm talking about.
I'm a picture expert at this point.
Yeah. What did they ask us if we had something when we were at the recent seminar, again, learning more about the Gainswave 2.0, they asked us if we had something. It was like some kind
Do you
of
have
animation.
A 3D pictorial thing or a...
Yeah, that you can show a patient with a 3D, whatever those
imaging.
Things are called. Yeah.
And I'm like, no, we just drop penises.
Yeah, we just draw them.
Just draw it. Just draw the structure, the anatomy that we're focusing in on.
Yeah, because we want to get not only into those small vessels that are directly going into the penile tissue, but also into the larger vessels and the groin. And so this allows us, even with this device and the way that it's curved, to get right into those groin vessels.
Yep, we did a treatment this morning with staff going over proper hand placement, proper placement with the new hand device. And it is pretty amazing the difference between the two and how you can manipulate the handpiece where you want it. So I'm really excited for our patients.
Yeah, no, it is super. It's a great addition. And again, we do not update lasers very frequently because we become very passionate about the results we're getting with the laser. So you really have to show us that there's some new technology that's going to improve outcomes, because that's ultimately what we're looking for, not devices. We are looking for results. And so with this, and again, every time we bring a new service in, it is hours and hours of onboarding. We went to Miami to do a training on it. We've been back. It's training the staff. So it's weeks of, just training and getting everyone up to date on protocols. So just know these are treatments that are non-invasive. We'll talk about that. But again, you should just not go to just anyone. You want to know that people are really putting in the time and effort and investment to the science and the devices that actually work for getting the results.
Absolutely. And you can go to one place and have the same treatment and go to another, have the same treatment and have a very different outcome based on how they're holding the handpiece, how they're directing that energy, that shockwave, how they're going about their protocols. So like Dr. Durst mentioned earlier, there's a lot of shockwave devices out there with no trademark name, no company. It's just very generic. We do shockwave. Well, what type of shockwave do you do? What device do you have? What protocols are you going on? Are you part of a provider network?
Correct.
Do you have protocols that have tried and true and tested with outcomes, repeatable outcomes?
Well, we've actually had a lot of patients that have come to us very upset with treatments elsewhere because and then also are skeptical about getting results with our treatments just because of the past. And I would just say, again, like a past relationship, would you base a current one on a past relationship? Probably not, right? You're going to give it a new try. So you just tried to say that again, if there's a lower price, there's probably a reason for it. This is a provider network, so there's standardized pricing. It's just the way it is. It's fact.
It's what it is. Yeah. And it's going to be the same anywhere you go. There's no upcharging. It's
Yes.
just what the price is based on the treatment.
Yes. And so I would say this is a non-invasive. So the nice thing is that it's comfortable. There's no needles. There's no
No
downtime,
pain,
no pain.
no numbing required,
Yeah. And this is
zero pain, which is amazing.
And again, the fact that you can regenerate tissue and not be uncomfortable with doing that. We do pair it with PRP injections or the P shot. And you can, enhance the P shot even with exosomes. But
Now, with that, you do need numbing.
Yeah. This in particular is without needles. And it doesn't need numbing for this. But yes, the injectables you do. And so, but this is going to get at the root cause of the vessels and improve the vascular health. And again, erectile changes are a barometer of vascular health, and sexual health is part of overall health. And so we need to be assessing erections because that's an early marker for cardiovascular disease.
Absolutely. Are you still getting morning erections? Are you still getting spontaneous erections? Think about that. If that has changed significantly, there's an indicator.
Yeah. So why we updated and upgraded to this system again, obviously more focused, deeper, and better penetration, better results. And there are some studies to support that too, with the comparison of radial versus focused. And there was a 15 study, and it was a meta-analysis with significant improvement over the radial. So it was definitely time. The science was evolving. And then again, who is this for? It's for anyone that has any changes in erection that interfere with your quality of sexual satisfaction. Period.
No, period.
Yeah.
And it can be you've put it off way too long and you're now in a severe state where you're not having any function, or it could be slight changes that you're starting to notice. So we see gentlemen along that whole entire spectrum of function.
Yeah. Yeah. So again, it could start with mild and it's interfering. It's, it hasn't been consistent. You've had inconsistencies of erections. So now you're starting to psychologically,
Self-doubt.
yes. And it's not a psychological issue, but it does play that psychological, it has psychological impact. Or you've tried PD5 inhibitors, so they're working. Maybe the efficacy has declined. Maybe it's not working. Again, maybe your doctor doesn't have any further solutions for you. And just know that, like Farideh said, the more it progresses, the more difficult it is to treat.
The more treatments you need, the more aggressive we need to be with treatments, the more series you're going to have to do or packages of treatments.
Yes.
So definitely the sooner you address it, the better, because the only guarantee is that it's just going to continue to get worse.
That is absolutely the guarantee.
Yeah.
And then if you've had prostate surgery, definitely for rehabilitation post-prostatectomy, Peyronie's disease or the curvature would be another reason for it. And again, or if you just want proactive optimization and looking for better blood flow, you're noticing even the most mild changes, that is a time to do it. And we do stack different things in addition to the Gainswave 2.0. So we have other stacking such as peptides or PT141.
Hormone replacement therapy, and then sometimes other laser treatments.
Yes. Yeah. Yeah.
So you definitely want to find someone that's very passionate about sexual wellness like we are. You can always come to Knoxville and come see us anytime. We do remote patients, but you definitely want to find a provider that is passionate. When we were asked in Florida about our superpower, Deb, what was our superpower?
That you can make any penis fully functioning.
That was our
optimally.
superpower.
Yes.
I don't think they knew what to say with that.
No. And vaginas. We said that we can make any vagina and any penis function.
Great again.
Great again. Yes. So that's the superpower that we have because we're passionate about it.
We're passionate about it.
Yeah.
So if I can give you any advice to take with you, it's to find providers that are passionate about what they're doing, because sexual wellness should be a passion if they're doing it, not something that they just throw a medication at you and say, oh, this is all I got. Because there's so much out there we can do.
We have 3 radial devices that are going to not be used as much as before. We do have a plan for them, but just because the science evolved and we knew we needed to upgrade
to a focused.
Yeah, so we had to get a focused machine, but we'll stack. So hormone replacement therapy or optimizing the cells to respond to regeneration. regenerative injectables or PRP injections, P-shot, in addition to the regeneration, PT141, nitric oxide support, PD5 inhibitors, even trimix, vacuum erection devices, things that we will do while we're regenerating. But
Home acoustic shockwave devices
home
to
acoustic,
continue
yes.
therapy.
And it all depends on where you are and meeting the patient where they are and being comprehensive in how we address it. But the other thing that Farideh is talking about is, again, we have a laser that's amazing and you can manipulate. It's a high end. I just did something on another video on that about vaginal rejuvenation and how that differs from what people think about with laser vaginal rejuvenation, because this device is a beast and we can manipulate how we deliver the energy so that we're just heating for regeneration with no tissue like damage, because sometimes you'll be ablating or firing a laser, but you'll get surface, ablation because you want it. But we can manipulate this one where we're driving the energy in deeper in just heating for regeneration. And that they started to add on. I went away for like a week and I came back and they were
New toy.
Yeah. They were adding, we had not
Just so
used
you know.
it. Yes.
We're doing this now.
We had not used it for erectile dysfunction. And so we started using it because we'll progress protocols and we have the most advanced laser
An amazing patient.
experts. Yeah.
An amazing patient. So really what drove that was an amazing patient that was like, yeah, let's try.
Yeah. And loved it. Like absolutely loved it.
Crazy results.
Yes.
Now, would they have gotten that great of a result with just that laser alone? I don't know. The ones who have done it have done Gainswave prior. So they already have that base regeneration, that base anatomy structure being helped. So it'll be interesting as we do see more and more patients and how we utilize that laser for those patients.
Well, we have 2 of those lasers and we have 3 of the Avives, and we were using the Radial, and I'm not even sure you would want to use a focused before you drive the light energy of a laser deeper. So I think those would be more of a superficial, you're communicating with the tissue and overall vibratory acoustic shockwave, and then focusing in the laser. Yeah. So this is kind of how our office operates, is that we all work together to really think, can we manipulate something that we have to make it even better? And we're just always progressing protocols. So
all for the benefit of our patients, to benefit our outcomes.
Yeah.
So it's come back to
the superpower.
New treatment.
And the superpower.
And the superpower.
Yeah. And just know that, again, it's about getting you guys results. Just know sex does not have to be different. We 1000% are of the mindset that sex does not need to be different as you get older, and could be even better than it was before, because now you may have experience, you might be in a committed relationship, and the knowledge base is there. There's so many reasons why it can
not so many interruptions during the day.
Yeah, your kids are grown. and now not so many interruptions. There's all kinds of reasons why it can even be better. And so just know that if you're feeling that it's different, it does not have to remain that way. There are tons of solutions. And so again, like Farideh said, we do see patients remote. Sometimes we will get on a planning consult and lay out what we would do and either help you find something maybe close to what we offer locally, or we bring you in to the office and see you here. So, but anyhow, so anything you think we missed?
I think we kind of hit all the main topics.
Yeah.
We're very excited.
Yeah. So let's start a conversation in the comments. So drop some comments and let us know your thoughts, any questions you have, any experience you've had with acoustic shockwave or OmniWave. If you had it, that's the actual device name. And just know that if you want to talk about anything else, let us know, because we are willing to deep dive into anything sexual wellness or wellness.